Hello, everybody. Welcome to another edition of ENC Health Watch. I'm Jeffrey Roberts. November is Diabetes Awareness Month, and we are taking a closer look to better understand and prevent this growing health concern. Joining me now is Dr. Susie Houston. She is a nurse practitioner and diabetes educator at ECU Health right here in Greenville. Thank you so much for joining me.
And thank you so much for having me.
So let's talk all things from diabetes. What exactly is diabetes?
So diabetes is when your body is not making enough insulin. And so if your body isn't making enough insulin, you may have type 2 diabetes. And before type 2 diabetes, it may be pre-diabetes. And before that even, you might get something like metabolic syndrome. So pancreas doesn't make enough insulin to put the sugar where it needs to go. And then there's the type 1, and this is just keeping it simple. Pancreas doesn't work at all, so you must get put on injections of insulin.
Those are the differences between type 1 and type 2?
Yeah, so the faultiness is your pancreas not making enough insulin. And the way I describe it, so a lot of patients will come in, and my first question is, well, how did you get here to my appointment? And then, do you know if you have type 1 or type 2? And some people are living with their diabetes for years, and they're not quite certain. So it used to be that you could consider type 1, if you drew the number 1 and put a belly button in the middle, that was the shape of people with type 1. Because their pancreas didn't work. And years ago in the 20s, when diabetes was discovered and the insulin was discovered, it was that you were skinny like a stick. And so, but we've got, our world we live in, we do less and we eat more. So type 1s have gotten a little fluffier. So it's not but a typical type 1 is usually slender in shape. A type 2, if you drew a number like a type 2 and put a belly button in the middle that's kind of a little fluffier around the middle, that's called insulin resistance. So if you've got extra around the middle, your pancreas, it works, it's just not getting the insulin to where it needs to get to. So big difference. Type 1, you need insulin to survive. If you didn't take insulin, you could get very sick, end up in the hospital. If you didn't get there in time, you could die from complications of no insulin.
Oh, wow.
Type 2 diabetes, it's varying stages, and it is a progressive condition. If you were diagnosed today with, let's say, pre-diabetes and you did nothing, no changes in lifestyle, like changing your eating habits, your drinking habits, within 5 years you could develop type 2 diabetes.
And it's all in the pancreas.
It's that pancreas, and then it's all the other things that you do or don't do, like activity. There's some words I don't like to use just because they sound bad or nobody wants to do them. Like diet. Sounds like a bad 4-letter word.
Right.
But people are on a lot of diets and they don't even understand how those were to help. And most of us have been on a diet at one time or another, but we didn't stay on it long enough to get the benefits, or we didn't sustain it. Like, we weren't sustaining it and didn't understand and we didn't keep up with it. But so healthy eating sounds like a nicer way to go. Physical activity is another thing, exercise. Those are other things that help with the shape of our body and helps our body be more efficient with insulin.
So generally when you see people getting diagnosed with diabetes, is it always type 1 or always type 2? Or is it is there a difference between the two?
Yeah, so of our total population in the globe, so around the world and America, Canada, everywhere, about 90 to 95% of the folks have type 2 diabetes with this if they're getting diagnosed. So the other 5 to 10% is type 1 diabetes. So it's a smaller percentage that have it. But then think about that initial diagnosis, very different. If somebody ends up in the hospital because of complications with high sugars that's related to a type 1 diagnosis, automatically they're in the hospital and here's 4 injections of insulin. Injections for food, breakfast, lunch, and dinner, and a basal or long-acting insulin. So 4 injections of insulin if you have type 1. With type 2, when people are diagnosed, the provider may just say, work on your, I don't like those words, diet and exercise, and come back and see me in 3 months or 6 months to see if that helped. But then people leave that office and go, oh yeah, it doesn't seem that important, I consider type 2 diabetes like high blood pressure, silent killer. It's slow. It doesn't just say one day, oh, got the diabetes. It's a slow burn, and so people don't notice. They just think, oh, I'm a little more tired. Must be because I'm a year older. Or I can't see so well, and they're 30. It must be because I'm a year older. Or I'm peeing a lot at night. Must be because, year older. So you can put off a lot of the symptoms and signs and just say, oh, just getting a little older. This must be what happens.
So I know you talked about it a little bit, but when you're treating folks with type 1 and type 2, is there a difference in even just the treatment of it?
Anyone diagnosed with diabetes should get something called DSMES, Diabetes Self-Management Education and Support. It's training. It's kind of like you're going to school for your health. When you're newly diagnosed, you should be getting connected with a certified diabetes care education specialist. There's 10 hours of content education.
Oh, wow.
Right. And so there's supposed to be a one-on-one. So this is if we lived in an ideal, perfect world, which most of us, we don't. Things get overlooked.
Yeah.
And even the diagnosis is sometimes quick. It's like people get a phone call, hey, your sugar's up. We've got a medication at your pharmacy. Pick it up in your glucose meter. And we'll see you in 3 months. So that education is covering the basis of healthy eating, being active, monitoring, medication, healthy coping, problem solving, and risk reduction. That's the DSMES. The other part is that because I belong to an organization for certified diabetes care education specialists, I'm a huge fan that we need to remind patients that they need to ask for this because we want everyone in our world to be self-managers with themselves for their blood pressure, their weight, just health in general, to stay on a great track. So I work at ECU Health Lifestyle Medicine. It's a clinic that's over at the ECU Health Wellness Center. We're in that building. And what we're looking at is helping people with chronic conditions be on the least amount of medications with lifestyle medicine pillars of health. And they tie in nicely with diabetes self-management education because it is healthy eating, which we try to focus on. And I know I'm in Eastern North Carolina, so I'm sending a little caveat out. I know we have barbecue here, but we're talking about whole food, plant-based, predominantly eating, and it's helping people understand that the health of our body needs great fuel. And so whole food, plant-based is trying to stay away from processed food, fast food, things that are easy and quick to pop in the microwave. With those pillars of health, we also talk about being active. We talk about social connections, like the people that are in our environment, in our home, our church family, our community family. It's noted that people that end up in the emergency room or hospital, if they don't have anyone to go home to, chances are they'll repeat a hospital stay. So that connection of having family. In those 6 pillars of health, we've also got risk reductions, and that's smoking and alcohol use. So most of my patients will say they don't smoke and they don't drink alcohol, but their risky substance would be Eastern North Carolina sweet tea. So they do have a drinking habit. And so we want to make sure that they know that those are empty calories, empty carbohydrates, and fuel, and drinks are fuel. And so just FYI, the best drink ever is going to be water, good old-fashioned water, because there's no other ingredients in it. So healthy eating with a whole food, plant-based focus, physical activity, doing the best that you can do. It's not saying you've got to go do a marathon, but just stepping up your game. The other piece is our managing stress. Stress raises cortisol. It's a hormone in our body, and it can impact blood sugars and impact weight. And right now you're hearing my insulin pump beep trying to tell me to do something. So I apologize. So I also have type 1 diabetes. And I've had that for, I think I calculated it before I came. I've had diabetes for 41 years.
Oh, wow.
So that's kind of a milestone because in the day you used to die if you had type 1 diabetes. There was no cure.
Right.
So it's not a cure, but my insulin pump keeps me living. Okay. The other part with our clinic is we also talk about in the pillars of health, sleep is really important. And sleep also helps type 2 diabetes, type 1 diabetes, all the diabetes, because most people don't understand the value and health properties of a good night's sleep.
Right.
And they struggle. And all of our 6 pillars of health, what I love explaining to people is almost each one of those, there's a medication for it. And we try to help people work on their lifestyle medicine skills and habits and changes so that they don't need medications from the pharmacy.
Well, welcome back to ENC Health Watch. I am Jeffrey Roberts, and I'm joined with Dr. Susie Houston. So I definitely want to talk about food this morning because we ran a story a couple of mornings ago about it was these dietitians, and they just went with their they went with their patients to the grocery store, and they were helping them go aisle by aisle, and this is what you should get, this is what you should stay away from. I mean, are those things beneficial?
Like a grocery store tour?
Yeah.
Oh, well, that was in our November Diabetes Awareness Month program. And so the grocery store tour, yes, they are. And we do those once a month in Greenville through Pitt Partners for Health. And so what it does, it helps you navigate the grocery store. And then think about it, if you're trying to make changes in your world, maybe manage your diabetes, prevent diabetes, or reverse type 2 diabetes, grocery store shopping, because we need to eat, you might want to think you're shopping like a farmer. Have you ever heard that expression?
I haven't.
So it's like you're shopping around the perimeter of the store.
Right.
So produce section, there's the meat section, the dairy section. Those would be things you would get at a farmer's like if you were a farmer. And there is no backup, or there's not a lot of people in the produce section. So you're going to have like all the fruits and vegetables to yourself.
Oh, yeah.
But that should be
First dibs.
You're right. That should be your main stop. And so the grocery store tours do help with that. And I love the idea that they give you, the ones we have now are a $15 gift card challenge. So I think it's Food Lion where we were doing it for this month. And then they give you a challenge to say, go buy food for a family of 4, trying to cover all your food groups, and then come back and see us. And so it's a health coach, a dietitian, or a provider could be there. And then they help you to see how you can maximize your money. Because with that, they think, many people think that healthy eating is expensive.
Yeah.
And it doesn't taste good. So I like to beg to differ.
I've heard that a lot of times because Bojangles sounds a whole lot, better than eating a salad. But I mean, sometimes it is better for you.
Right. And sometimes I guess you do have to get your Bojangles on.
Yeah.
Sometimes, says
Sometimes.
my husband. So
Yeah.
I'm a vegetarian and he's a carnivore, so we're opposite spectrum. So you have to, so you meet people where they're at.
Right.
But if half your plate, I don't know if Bojangles, I don't know, we're not doing a special for Bojangles, but I don't think they have a salad, do they?
I'm not sure.
See, you don't order that. So habit changing is very helpful in making health changes.
Right.
Like, so if you can change a habit, if it was only Bojangles once a week versus every day, that's a win. And if it was and make sure if you are going to do on the grocery store tour or going grocery shopping, that you buy small amounts so that things don't go bad, especially from the produce section, because then
Right.
it's disappointing. And then you feel like you've wasted your money. And I am a fan of frozen fruits and vegetables and even canned, because all of those fruits and vegetables that are frozen and canned, they were picked at the prime season. They're ripe and ready and they taste good compared to a strawberry in December. That strawberry was not grown around here in December. So it had many miles to travel. It wasn't even red when it was picked. And then we're expected to, so save your money for when things are in season, especially Eastern North Carolina.
Right. One of the things that I hear is people saying, here's this diet and it can help you cure your diabetes, or if you eat this superfood, this will help you, stop all the things like that. What are some of the things that you've heard and sort of the education you have in regards to food?
Yeah. Well, I've heard a lot, and they probably have the whole wall covered in things, but it's a diet of every sort. As soon as somebody brings that word up, I'm just like, uh-oh. And then I have to get them to explain it because, like, what does that even mean to them?
Right.
What's it include? Anything where it's a diet to me, and I try to explain to the folks that come to see me, it puts a restriction on things. And you were bound to lose weight if you went from eating what you normally do, not having a care in the world how many calories, how many grams of carbohydrates, how much salt, you didn't, and then you were restricted. Yeah, and if you stayed on that even for a few weeks, you would lose weight. It would change. But it's not built for longevity. It's not built for sustainability. So that makes it harmful, because then if you go off it, what happens to your weight per se? It rebounds.
Right.
And our weight likes to be at the highest weight we ever were. So that's a tough one for people to realize. Could have lost the weight trying to get into a dress for their wedding or something, or a party, and then they're off it, and now it's back, and our metabolism gets all messed up.
Are there like diets per se you would recommend, or would you go toward the route of like cure certain groups of foods that you should probably try to eat more?
So I don't like that diet word. And so with the healthier eating plan, there is no restrictions for, say, diabetes. It's just the amounts, and you need to know what you're doing and what food group it came from. The biggest one is one of my favorite F words, which is fiber. I'm not going to swear on TV or wherever. But fiber, and people don't understand that fiber slows everything down. So if you can get high fiber value, you can eat as much as you want, because you won't be able to eat tons. You could eat a lot of fast food and then not feel great, but it won't be the satiety, or you'll feel hungry a little later. So fiber, our ultimate goal is 25 to 30 grams per day. Most people are probably getting less than half of that.
I was going to say, that sounds like a lot.
Well, and you don't know if you don't know what you're looking at on labels have it in our cell phone. We can look up high fiber value foods, or you can type in nutrition facts for XYZ if it's a restaurant, fast food. Find ones that are higher fiber. And what happens with fiber is it takes your body a long time. One, if you're chewing a lot up here, that means it's probably a whole food. So a whole food plant-based are things that there's a lot of work, which means it slowly goes down your digestive tract. And then when it gets to your stomach has to do the work. Processed and fast food, all that work got done at the factory. So when it goes in, there's not much. It's done up here, slides right through, and it turns to sugar, spikes sugar up. High fiber foods slows down so that then instead of sugar spiking up from a meal or a food, it slowly goes up so that the pancreas that makes insulin has time to bring the numbers down. Also in that, this is like the poor person's or your body's natural way to create a GLP-1 and GIP, which are natural hormones in our body that are some of the weight loss injectables. So high fiber foods, before think of those things or talk to your provider about it or get connected with a registered dietitian so that you can find out what that even looks like before you even think about adding a medication on. With our lifestyle medicine clinic where I work, we are trying to help people work on those 6 pillars of health so that they don't need more medications. And once you take a medication, what happens if you have a side effect?
Right.
Add another medicine on, and then another and another, and then next thing you know, you're not sure what's happening. So that idea of being a great self-manager for your health is really important.
Definitely is important. We're going to sneak in another quick break. Stay with us. Welcome back to ENC Health Watch. I am here with Dr. Houston. So we have been talking a lot about diabetes, but just going back to the basics again, when people get diagnosed, what are some of the signs and symptoms that they should look out for?
Yeah, so usually what will happen is people will start drinking a lot. Like they're really, really thirsty, like almost like a thirst you can't quench. So they're drinking gallons of water and then or anything that they can get their hands on, not just water, juice. And then they think that's why their numbers are so high, blood sugars are so high. And then when they're drinking so much, they're going to the bathroom a lot. The other thing could be, so they're peeing a lot, getting up all the way through the night. They might have infections that don't heal, like got a little cut on their toe or their finger and it's just not healing. They might end up with yeast infections or urine infections and then thinking, oh, that's the reason they go to the doctor is because they think they've got a urine or yeast infection. Vision, sometimes people end up at the eye doctor because they've got blurred vision and they're not seeing. And then the eye doctor's saying, oh, how long have you had diabetes? And they're like, what?
Once someone is diagnosed, though, like what does everyday treatment look like for them?
So depending if it's type 1 or type 2, typically you would want someone to monitor their sugar. So checking with a glucose meter, that's a finger stick, poking their finger and getting the blood out, takes a few seconds. So they would need to have a glucose meter and test strips and lancet device and lancets to poke their finger. And then some people use a continuous glucose monitor, but that's dependent on insurance coverage. So monitoring sugar, but then also monitoring what happens when they eat certain things and drink certain things.
I know you were talking about a pre-diabetic test that someone could take too. How does that work?
Yeah, so the pre-diabetes test comes from the CDC or the National Diabetes Prevention Program, and there are 7 questions, and I've got them here that it's written down. You can go online and just put in pre-diabetes risk test. This is before, there's no blood involved, which I like because I'm cheap and frugal and like people to save money and time. But the idea is when you do this, it talks about like the 7 questions, how old are you? So the older you get, the more risk you are for type 2 diabetes or pre-diabetes. But let's just say you get a point after you're 40, and then it goes up 50 to 60, 2 points, 60 plus, you get 3 points. If you're a guy, you get a point. Sorry. And then if you're a woman, no points. If you were a woman and you had gestational diabetes, which means you were pregnant when you were when you were pregnant, you had diabetes for that short period of time, then you get a point. If you have a family member, mother, brother, sister, father with diabetes, you get a point. If you've got high blood pressure diagnosis, and even for those that don't claim it, still is a point. Like some people think, I haven't got it. You get a point. And then if you're not physically active, 150 minutes of physical activity a week, then that's inactive, you get a point. And then it bases you on your weight. So height and weight, we look at different categories. There could be normal weight, overweight, obesity, you get a point. 5 or above, you're at risk for prediabetes, which if you do nothing 5 years later could be type 2. When I've got most people and we go through this, especially if they're inactive in their weight, with their BMI is greater than, let's say, 30, or it could be 28, 30, I give them, sadly, pretend diabetes is their diagnosis so that they start working on all the good stuff we just talked about.
We are going to take another short, quick break. We'll be right back. Welcome back to ENC Health Watch. I am here with Dr. Houston. So I want to just read off a couple of these stats. I'm sure you've seen some of them. This is from the North Carolina Department of Health and Human Services. They say that they're expanding their minority diabetes prevention program. They say that 1 in 8 adults in our state is living with diabetes. And since 2021, diabetes-related deaths have actually gone up about 20 to 40% in some parts of our state. I mean, when you hear stats like that, what's your reaction?
Well, I'm not surprised. I know we're in the Bible Belt. We're also in the sugar belt, the heart disease belt, that like for North Carolina, Eastern North Carolina, but then you look at our periphery. And if we don't have diabetes educators across the state that are accessible, so accessible to care is one, accessible to getting medications is another, and just even like say you're not feeling well, and some people aren't going to their primary care on a regular basis to see that, oh gosh, my numbers are creeping up.
Right.
So then they're getting diagnosed, not too late, I'll say, but later when things have started to get compounded with complications.
Definitely. I mean, that education really is key because a lot of the times you can lessen, prevent, and even, circumvent and hopefully pause some of those things from happening. So when you do get people that may have those sort of educational pieces where it might hinder them a little bit, like what sort of things can they do to help out?
Mm-hmm. So one, rethink your drink. So that would be the one you could do at home. Like make sure you don't even need to read your English on a label. You could just look for zeros all the way down. And so all drinks should be 0 carbohydrate, 0 everything. That's a helper. Nutrition is trying to get all the food groups covered and trying to eat maybe on a smaller plate, trying to eat smaller portions. Things add up. Fiber, again, that always helps if you can squeeze it in. Half your plate should be non-starchy vegetables. And I think of in the land of Eastern North Carolina, we've got collards, cabbage, mustard greens. We've got all the things that come from the farm. Even sweet potatoes, they can fit in. They'll be a starchy one, but they've got high fiber.
Final thoughts?
Be more informed in your health and just you can't take it all in at one time. Focus on one thing that you think you need. It might be your sleep. It might be your stress level. It might be, I need to check in with my primary care. And maybe I need to get connected with the lifestyle medicine clinic. You never know, we might be able to help.
Dr. Houston, thank you so much for spending some time with us. We really appreciate it.
Well, thank you so much.